Hello. Good evening, viewers. We are continuing our day 2 systems medicine concept. I hope yesterday we got a little bit of idea, at least a bit of definitions, a, a very little bit of clarity about the definitions. What are the definitions of system, structure, process, and approach and states? You don't worry about the sequence, okay? Because I also got some responses. Some people ask problems, but I think we will take the problems at last of the video because I have to cover a few more topics and hopefully कुछ problems जो हैं ऑटोमेटिकली सॉल्व भी हो जाएंगी. तो आज हम कुछ नए कंसेप्ट पढ़ते हैं. लास्ट डे जो हमने सिस्टम को लेके जो डेफिनेशन पढ़ी थी, सो व्हाट इज अ सिस्टम. सिस्टम इज बेसिकली अ सेट ऑफ एलिमेंट्स विद सम इंटर रिलेशंस. वेरी सिंपल डेफिनेशन बट वेरी यूजफुल. अब सिस्टम की हम जो बात कर रहे हैं तो थोड़ा सा एक स्टेप थोड़ा डीप में जाएंगे. सिस्टम जो होते हैं दे कैन बी क्लासिफाइड इनटू स्टैटिक और डायनेमिक. अब ये स्टैटिक और डायनेमिक क्या चीज़ है देखते हैं. लेट्स से देयर इज अ केमिकल रिएक्शन. There is a chemical reaction, substance A, substance B, they react reversibly and form a product AB. So in this case, as we have seen in our example, last example, what are our elements? So our elements, we used to say substance A, substance B, or substance AB. And states are concerned, we take states as the concentrations of A, B, and AB, and there are another states also. So now if some process is going on, okay, this is a chemical reaction and this is a reversible chemical reaction, so we can say a process is going on. So what is happening in this process? So whenever you think of a process, you I what is our definition? Process is something जहाँ पे कुछ states change हो रही है. ठीक है. So always whenever a word process comes, you have to think like this कि भाई what are the states. Is there any state is changing with respect to time? So we can say some process is going on. What is happening in medical literature? um, Many special terms are given to the process, okay, but sometimes it is not always some special term is there. Sometimes we have to create our own term, okay, like I will just example of some terms that denotes process is like ventilation, excitation, contraction, coupling, neuromuscular transmission. Okay, so these all terms are basically defining the process. But there are many processes in which there is no very special term is given to them. Then we have to create our term. So in this case, a process is going on. That is the name of the process is the chemical reaction, and it is a reversible type of chemical reaction. So what is happening in this process? Concentration of A is changing. Initially, let's say its concentration is A, initial concentration of B is B. Okay, and its concentration is gradually rising. So what is basically happening, if we plot a graph, this is time axis and we take the concentrations here. So what we understand from our high school basics is that the concentration A will gradually goes down. Concentration of B may also gradually goes down, and concentration of AB may gradually takes up some value. Okay. So you can see there is a phase. We can here what is happening. Here some states are changing. Okay. So when states are changing means system is in dynamic phase. Okay. This is the dynamic. We can call it dynamic phase or it's a dynamic system here. Okay. And once the states got constant, their values got constant, one equilibrium is achieved, then we can say now it is become a is in a static phase. Just to make the concept clear, but actually what is technically happening here, also the processes is going on, and both the processes are equal and opposite, so the states are not changing. Okay, so but still we can think like this, कि static system is something where states are not changing. Okay, so we have to think like this, in system it may be static or dynamic. So one thing we should know, this now, what type of system is living beings, this we have to explore. And today we will discuss about the living systems. So because living systems are not easy systems, they are complex systems. And till now we have tried our concepts to RC circuits and simple chemical systems. But when we talk about the living systems have something complex. So as far as living systems are concerned, what is the special thing that the living beings have? We studied in 11th class biology book that they have some properties like reproduction, growth, metabolism. Okay, but there are some exceptions to everything. So we can't say कि there is any property that is very peculiar to the living systems. ठीक है, ये properties जो हैं living system non living systems में भी कहीं ना कहीं मिल जाती है. So but one property that is very important, or the we can say the design of the living systems are something like this, कि living systems are hierarchically organized. Okay, so that is one important, very important thing as far as living systems are concerned. They are hierarchically organized, and this leads to what? A different levels of organization. So we have to think in terms of the levels of organization. So whenever we talk about living systems, we should think levels of organization, at which level we are talking about. Okay, now we will deal more this thing, level of organization. As you know, levels of organizations are gradually, as we go from lower to higher level of organizations, something new is happening. So let's see what is happening. Let's say we will take our level as atom. ठीक है, so for a chemist or for a physicist, atom may be a system. Okay, now if atom is my system, what are its elements? We can think of electrons, protons, neutrons, something like this. Okay, then what is happening? Structure. Structure is some sort of relationships. Okay, and between the properties or characteristics of these elements. Okay, ये हमने पढ़ा था कि relationship होनी चाहिए, और इस relationship को we can represent by mathematical equations. Okay, so chemistry और physics में हमको काफ़ी सारी equations हमें मिल जाएंगे that represent the structure of the atom. ठीक है, तो structure of the atom हो गया. अब स्ट्रक्चर के बाद में अगर इसका हम मैनी एटम्स जॉइन एंड फॉर्म अ मॉलिक्यूल. अब जब ये मॉलिक्यूल बनेगा एटम से, कुछ एटम्स मिलेंगे एंड इट फॉर्म्स अ मॉलिक्यूल, तो इसमें नई प्रॉपर्टीज या नई स्टेट्स बन सकती है. ठीक है, नई स्टेट्स जैसे लेट से एग्जांपल लेते हैं यहाँ पे, कि अगर एक हाइड्रोजन एटम, एक और हाइड्रोजन एटम और एक ऑक्सीजन एटम अगर मिलते हैं, तो इट फॉर्म अ समथिंग न्यू स्टेट्स, लेट्स से कि एंगल बिटवीन देम. सो दिस इज अ वन स्टेट वी कैन टॉक अबाउट. तो मॉलिक्यूल जब बना तो एक नई स्टेट क्रिएट हो गई. ठीक है, इसकी स्टेट्स की बात करेंगे, इसकी स्टेट्स क्या हो सकती है? लेट्स से कि एटॉमिक रेडियस, रेडियस इज वन थिंग जो इसकी स्टेट बता सकती है, या इसका जो एटॉमिक मास है. ठीक है, एटॉमिक इसका मास है, एटॉमिक नंबर है ना, एटॉमिक मास है. इसका भी मॉलिक्यूल का रेडियस, तो बिकॉज स्फेरिकल नहीं है तो बोलना मुश्किल है, बट इसमें अपनी डाइपोल प्रॉपर्टीज हो सकती है, इसमें इसका डाइपोल मोमेंट हो सकता है, इसका मॉलिक्यूलर मास हो सकता है इसका, है ना, नंबर्स हो सकते हैं। तो अदा व्हाट आई वांट टू से इज एज वी गो फ्रॉम लोअर टू हायर लेवल ऑफ ऑर्गेनाइजेशन, सम न्यू प्रॉपर्टी इमर्जेस और न्यू स्टेट्स आर इमर्जेस, सो वी हैव टू फॉलो दीज थिंग्स। सो मॉलिक्यूल की अब हम और बात करते हैं। अगर एक कलेक्शन ऑफ मॉलिक्यूल्स है, ठीक है, सो इट में फॉर्म अ सब्सटेंस, इट में वी विल कॉल इट अ सब्सटेंस, ठीक है। तो ये हो गया नॉन लिविंग की तरफ हम जा रहे हैं। बट मॉलिक्यूल से हम अगर अब लिविंग सिस्टम्स की तरफ बढ़ते हैं, तो मॉलिक्यूल्स विल फॉर्म सेल, ओके, एंड सेल, ग्रुप ऑफ सेल्स विल फॉर्म टिश्यू, एंड टिश्यूज विल फॉर्म organ, organ will form organ system, and group of organ systems interact with one another to form an organism, and many organisms of the same species may form a population or community, and different populations interact to form ecosystem. An ecosystem along with its environment is known as biosphere. So from this level, even we can go beyond this also, subatomic particles, but we are not interested in that. If we are going higher level of organization, now you have to think what are the new states are emerging. Let's say this let's say pressure. Pressure is something that is not atom has no pressure, okay, one single molecule has no pressure. So it is a pressure is a property of a substance, okay. Once there is a pressure means a gas is confined to a container, then you will find a pressure. So pressure is something that state will emerge after it has to be at a certain level of organization, then only we can say that state is there. So as far as living systems are concerned, like cell, okay, सेल के अंदर हम कहें कि मेम्ब्रेन पोटेंशियल, ओके, द पोटेंशियल ओवर द प्लाज्मा मेम्ब्रेन, सो मेम्ब्रेन पोटेंशियल इज अ स्टेट ऑफ अ सेल, ओके। अब इट इज नॉट अ स्टेट ऑफ अ सिंगल मॉलिक्यूल, तो एक नई हमारे पास में यहाँ पे स्टेट हो गई। इसी तरह से टिश्यूज में जाएंगे, ऑर्गन्स में जाएंगे, ठीक है, तो हमारे पास में कुछ नई स्टेट्स इवॉल्व होगी, ठीक है। लेट्स से कार्डिक आउटपुट, ओके, या हम ब्लड प्रेशर कहें तो पूरा का पूरा ऑर्गन सिस्टम इन्वॉल्व होगा। ब्लड प्रेशर इन्वॉल्व्स द रेजिस्टेंस आल्सो, ठीक है। सो इट इन्वॉल्व्स, देयर इज न्यूअर स्टेट्स आर कमिंग आउट। तो ये हमको थोड़ा सा ध्यान रखना है। तो जब भी हम लिविंग सिस्टम्स पढ़ रहे हैं, क्योंकि हमारे पास में जो प्रॉब्लम्स आई है, कुछ लोगों ने जो प्रॉब्लम्स बताई है, उसमें व्हाट दे आर टॉकिंग अबाउट, इसमें ये चीज़ को पहले इंटीग्रेट करना है, एट विच लेवल वी आर टॉकिंग अबाउट। सो फर्स्ट मॉलिक्यूलर लेवल पे हम अभी थोड़ी आज बात करेंगे, जिसमें कि हम एक्चुअली वी विल टॉक अबाउट द मैक्रो मॉलिक्यूल्स, ठीक है। मैक्रो मॉलिक्यूल्स में हम देखेंगे स्ट्रक्चर वगैरह की चीज़ को, देन ग्रेजुअली वी विल मूव टू द सेल, टिश्यूज एंड फर्दर स्टेट्स। सो वेन एवर यू आर रीडिंग, तो four questions is very important. What is the system I am discussing? Okay, so and the second is the states, then structure, and then process. Okay, approach is okay because approach अभी इतना एकदम से समझ में नहीं आएगा। So जब system की बात कर रहे हैं, so whenever we are dealing with living systems, so one more question is there, at which level of organization आई एम डिस्कसिंग और आई एम फोकसिंग, ओके। जो किताब में कोई भी लाइन लिखी है, सेंटेंस लिखा है, तो फर्स्ट यू शुड क्लियर एट विच लेवल ऑफ ऑर्गेनाइजेशन आई एम टॉकिंग अबाउट, ओके। इज इट अ सेलुलर सिस्टम, इट इज अ इंटरेक्शन बिटवीन सेल्स, और इट इज अ इंटरेक्शन बिटवीन ऑर्गन्स और ऑर्गन सिस्टम्स, ओके। सो दिस इज द लेवल ऑफ ऑर्गेनाइजेशन वी हैव टू टेक केयर, ठीक है। इसमें हम ये भी कह सकते हैं, अगर वी विल टॉक अबाउट पीएसएम, okay, once population is there, so what are the states that define a population? Population के केस में हम बता सकते हैं कि the prevalence of a disease, incidence of a disease, these are the states of a population or community, okay. Literacy rate, unemployment rate, these are the states that define a population, okay. Even number of peoples, population कितनी है वो भी हम उसमें बता सकते हैं कि वो इसकी स्टेट। सो स्टेट में चेंज एट डिफरेंट लेवल्स। सो जो प्रोसेस है, वो प्रोसेस का भी लेवल है कि वो प्रोसेस किस लेवल पे अकर हो रहा है, सेलुलर प्रोसेस है या वो हायर लेवल का प्रोसेस है, ठीक है। वेंटिलेशन, अगर आई एम सेइंग वेंटिलेशन, वेंटिलेशन इज अ प्रोसेस, बट वेंटिलेशन इज नॉट अ सेलुलर प्रोसेस, वेंटिलेशन जो है पूरे एक ऑर्गन लेवल पे हो रहा है, ठीक है, या ऑर्गन सिस्टम लेवल पे हो रहा है। तो जैसे जैसे हम ऊपर जाएंगे थोड़ा कंफ्यूजन तो बढ़ना ही है, ठीक है, चीज़ें इतनी भी सिंपल नहीं है, बट हाँ हमें एक आइडिया मिलेगा कि व्हाट वी आर टॉकिंग, वी हैव समथिंग टू ऑर्गेनाइज्ड, ठीक है, हमारा जो मेडिकल लिटरेचर है हम उसको एक ऑर्गेनाइज कर पाएंगे, और ग्रेजुअली यू विल फाइंड द थिंग्स बिट इजी। ओके, तो हम देखते हैं कैसे अपन इसको और सिंप्लीफाइड कर सकते हैं। सो ये तो एक बात हो गई रिगार्डिंग द लेवल ऑफ ऑर्गेनाइजेशन। अब कल हमने एक और बात करी थी कि आज हम फंक्शन की भी बात करेंगे। अब फंक्शन क्या होता है? अब ऐसे तो सबको पता है फंक्शन क्या होता है ना। इवन आई आस्क्ड अ क्वेश्चन, व्हाट इज द फंक्शन ऑफ डाइजेस्टिव सिस्टम, व्हाट इज द फंक्शन ऑफ किडनीज। अब इस फंक्शन को, बिकॉज द दिस वर्ड इज इम्पॉर्टेंट, बिकॉज वेन एवर अ पेशेंट कम्स टू यू, मोस्टली इट इज ड्यू टू द एबनॉर्मल फंक्शन। अगर किसी को दर्द हो रहा है, ठीक है, या अगर किसी को और कोई फीवर हो रहा है, तो देर इज सम एबनॉर्मल फंक्शन। ये कंप्लेंट्स इटसेल्फ एक सिम्टम्स है ना, सिम्टम्स एक परसेप्शंस हैं, ठीक है, चक्कर आ रहे हैं, तो ये तब चीज़ें आ रही है कि जो फंक्शन नहीं होना चाहिए या जो स्टेट नहीं आनी चाहिए वो स्टेट प्रेजेंट हो रही है। सो देर इज सम एबनॉर्मल फंक्शन, एबनॉर्मल स्ट्रक्चर को भी लेके आ सकता है वो, ठीक है। सो वेन एवर पेशेंट कम टू यू, इट इज बेसिकली एबनॉर्मल फंक्शन और सम सॉर्ट ऑफ एबनॉर्मल स्ट्रक्चर। तो अब एबनॉर्मल फंक्शन, फंक्शन को प्रॉपर तरीके से डिफाइन करते हैं कि फंक्शन क्या है। सो लेट्स सी, जब भी मैं कहूं कि फंक्शन क्या है, ऑर्गन सिस्टम का फंक्शन क्या है, सो फंक्शन ऑफ डाइजेस्टिव सिस्टम, यू शुड थिंक लाइक दिस, व्हाट दैट सिस्टम और व्हाट दैट सिस्टम इज कंट्रीब्यूटिंग टू इट्स हायर लेवल ऑफ ऑर्गेनाइजेशन। सो डाइजेस्टिव सिस्टम का फंक्शन पूछ रहा हूं, तो व्हाट इट कंट्रीब्यूट्स टू द ऑर्गेनिज्म। इस बात को समझो कि डाइजेस्टिव सिस्टम का फंक्शन पूछ रहा हूँ, तो डाइजेस्टिव सिस्टम जो है वो जो जो भी वो काम कर रहा है उससे उसका जो हायर लेवल है उसको क्या कंट्रीब्यूशन हो रहा है, तो वो उसका फंक्शन है, ठीक है। सो द फंक्शन ऑफ डाइजेस्टिव सिस्टम, आई थिंक द बेस्ट आंसर इज टू प्रोवाइड न्यूट्रिशन टू द बॉडी, is to provide nutrition to the body, because many times I asked this question and I got the repeatedly same answers कि डाइजेस्टिव सिस्टम का फंक्शन ये है, एब्जॉर्प्शन कराता है, डाइजेशन कराता है। ये आई थिंक इट इज नॉट द फंक्शन। फंक्शन ये है कि वो न्यूट्रिशन प्रोवाइड कराता है बॉडी को, एंड उस फंक्शन को पूरा करने के लिए दीज आर द प्रोसेसेस दैट आर गोइंग इन दैट सिस्टम, ठीक है। तो डाइजेशन हो रहा है, एब्जॉर्प्शन हो रहा है, गैस्ट्रिक मोटेलिटी हो रही है, स्वेलोइंग हो रही है, गैस्ट्रिक एम्पटिंग हो रही है, देयर आर लॉट ऑफ प्रोसेसेस गोइंग ऑन टू जस्ट फुलफिल दैट फंक्शन, ठीक है। तो हमें इस तरीके से सोचना है कि फंक्शन अगर किसी का हम पूछते हैं, तो उसके हायर ऑर्गेनिज्म पर वो हायर लेवल को क्या कंट्रीब्यूट कर रहा है। तो विद दिस मेथड अगर हम ये देखेंगे कि जब भी हम किसी एबनॉर्मल स्ट्रक्चर या फंक्शन की बात करते हैं, if that abnormal structure or function lies at very lower level of organization, let's say collagen, ठीक है, collagen में सपोज देयर वाज फाउंड सम म्यूटेशन और कोलेजन का जो स्ट्रेंथ है जो भी है वो चेंज हो गया, ठीक है। तो कोलेजन की वजह से, बिकॉज वी नो कि कोलेजन जो है वो एक मॉलिक्यूल है, अगर इस लेवल पे गड़बड़ हुई, तो अब कोलेजन इज अ पार्ट ऑफ वेरियस डिफरेंट डिफरेंट टिश्यूज, ठीक है। सो कोलेजन की वजह से डिफरेंट डिफरेंट टिश्यूज में गड़बड़ होगी, डिफरेंट डिफरेंट टिश्यूज का स्ट्रक्चर बिगड़ेगा, ठीक है, और डिफरेंट डिफरेंट टिश्यूज का फंक्शन बिगड़ेगा। सो हम जितने लोअर लेवल पे गड़बड़ होने वाली है स्ट्रक्चर या फंक्शन में, तो उतना ही ज्यादा इम्पैक्ट उसका बड़ा पड़ने वाला है बॉडी पे, ठीक है। मैनी लेवल्स और टिश्यू डिफरेंट ऑर्गन सिस्टम्स और ऑर्गन्स में इन्वॉल्व। तो इस बात को हमको ध्यान रखना है कि उसका इम्पैक्ट किस लेवल पे है, ठीक है, क्योंकि उसका फंक्शन ऊपर वाले ये डिफाइन करेंगे कि उनको क्या कंट्रीब्यूशन हो रहा है, ठीक है। और कोई अगर एग्जांपल लेते हैं इसमें, सो आई थिंक अभी तो मुझे ये ध्यान आ रहा है। ओके, तो आई थिंक अ बिट ऑफ क्लैरिटी थोड़ी सी आ रही है कि फंक्शन क्या होता है। हम ले सकते हैं, लेट्स से व्हाट इज द फंक्शन ऑफ किडनी, ठीक है, किडनी का भी फंक्शन ले सकते हैं। Everybody thinks one thing, excretion of nitrogenous waste, yes, excretion of waste products. But I think excretion means, what is excretion? अगर excretion को थोड़ा सा बारीकी से देखा जाए, तो it's a process and it is a transport process. Excretion is basically a transport process. Okay, liver का क्या function है? और एक ऑर्गन के कई सारे फंक्शंस भी हो सकते हैं। ओके, लीवर का यूजुअली वी से इट कॉज डिटॉक्सिफिकेशन। डिटॉक्सिफिकेशन से थोड़ा सा समझ में आ रहा है कि डिटॉक्सिफाई कैसे करता है, बाय केमिकल रिएक्शंस। ओके, केमिकल रिएक्शन होती है लीवर में। तो एक्चुअली लीवर भी वेस्ट प्रोडक्ट्स को रिमूव कर रहा है, किडनी भी वेस्ट प्रोडक्ट्स को रिमूव कर रही है, बट किडनी इज डूइंग by which process? Excretion process. And liver is doing by chemical process. Both are doing the removal of waste products. uh, One more example, that what is the function of CVS and what is the function of respiratory system. एक दोनों का कॉमन फंक्शन है, या ब्लड की भी हम बात कर सकते हैं, तीनों का एक कॉमन फंक्शन है. सो मेनी सिस्टम्स में इन्वॉल्व इन अ कॉमन फंक्शन. लेट्स से द वन इंपॉर्टेंट फंक्शन इज टू प्रोवाइड ऑक्सीजन टू द बॉडी, ऑक्सीजन टू द टिश्यूज. तो ऑक्सीजन टू द टिश्यूज, रेस्पिरेटरी सिस्टम का भी अपना रोल है टू प्रोवाइड ऑक्सीजन टू द टिश्यूज. कार्डियोवास्कुलर सिस्टम और सर्कुलेटरी सिस्टम आई विल से, उसका भी रोल है टू प्रोवाइड ऑक्सीजन टू द टिश्यूज. ब्लड, ब्लड का भी फंक्शन है टू प्रोवाइड ऑक्सीजन टू द टिश्यूज. सो ऑल थ्री systems have the same function. So whenever patient come to us with a complaint of breathlessness, so then we have to think, if this is the abnormal function, what are the systems are responsible for it? Then we have to find out, is it a respiratory system, is it a cardiovascular system, or is it due to the blood? Then we have to find out the, we will take the history, or we will customize our history taking physical examination investigation accordingly. Okay. If we want to like if a patient come to me, if he has good amount of breathlessness, severe breathlessness, what we will do, we will first check the partial pressure of oxygen or saturation of oxygen. So at least it helps to rule out the respiratory system. If your uh, saturation is okay, then you can at least rule out the respiratory system. So like this we can this is all analytical thinking we can do in patient management. Okay, so I think I have cleared the idea of function also. Now, moving ahead. Okay, so whatever we have learned till now, we will now focus on one system, that is a molecule, protein molecule. Okay, so today we will discuss the protein molecule, and after that we will take some problems. Okay, protein molecule. Everybody knows proteins are made up of amino acids, and this is the chain of amino acids. Now again, our system is protein. Now what you have to think, what are the elements of this system? So as you know, elements is the, all the amino acids constitutes the elements of the system. If we talk about the structure, structure means relationships. So what relationship exists? Basically, one amino acids is bind to another with amide bond. Okay, so bond is nothing but an interaction or interrelationship. ठीक है, so amino acid joined together by amide bond in a particular sequence. So there are lot of amide bonds. So these amide bonds constitute the structure, and this structure is known as the primary structure. So primary जो structure है, that is due to the amide bonds. ठीक है, that is due to the various amide bonds. Okay, प्रोसेस की अगर हम बात करें, तो प्रोसेस अभी तो ये स्टैटिक उसमें आ गया है, ठीक है, बट वी कांट से स्टैटिक. देखो, आई विल टेल यू वन थिंग, all the macromolecules have some, we are presently considering one protein molecule. Okay, when we say proteins, some proteins, we sometimes we consider the all the proteins of a cell. Okay, when we consider like this, so there is some rate of formation of proteins and there is some rate of degradation of proteins, and every macromolecule will degrade at some rate because of some noise or whatever another chemical reactions. So there are two things, either we are taking single molecule or we are taking all the molecules at a time. Okay, so in this case we just take one molecule here. So we can talk about the process when this molecule is forming. Okay, its newer amino acids are increasing, something like this. So we can talk like this. So this is the primary structure, but primary structure is given by the amide bond only. Okay, now what happening? Again, same protein molecule. Now the chain of amino acids, few amino acids, a chunks of amino acids interact with another chunk of amino acid. Okay, and what they are forming, sequence of amino acids means chunks. One chunk is interacting with another chunk. What type of interaction? Let's say hydrogen bond. And what they are forming? They are forming the alpha helix or beta sheets or many other structures like that. Many other types of uh, structures like these. Okay. So in this case, what is the element? It is the chunk of amino acids. So different chunks of amino acids are interacting by hydrogen bonds. Okay, so this type of structure is known as the secondary structure. Secondary structure. So secondary structure is due to the hydrogen bond. We going ahead now. We This molecule is organizing at a more higher level, and what is happening now here, the elements are the alpha helices, okay, and pleated sheets or turns. Okay, so these different elements are interacting again, and they are forming a higher level of molecule. In this case, these elements interact with disulfide bonds and ionic bonds to form polypeptides. So this type of structure we can say tertiary structure. टर्शरी स्ट्रक्चर यहाँ पे बन रहा है. सिमिलरली इसको हम इस लेवल पे कह सकते हैं कि एक पॉलीपेप्टाइड है. देन अगेन इफ यू गो फर्दर, सो पॉलीपेप्टाइड्स, अगर क्वाटरनरी स्ट्रक्चर की बात करें, अब जो प्रोटीन है, ओवरऑल प्रोटीन है, इट आल्सो कंसिस्ट ऑफ डिफरेंट पॉलीपेप्टाइड्स. नाउ पॉलीपेप्टाइड्स आर द एलिमेंट्स ऑफ इट, एंड पॉलीपेप्टाइड्स इंटरेक्ट विद वन अनदर लाइक वाया हाइड्रोजन बॉन्ड्स और वैन डर वाल्स फोर्सेस और अनदर हाइड्रोफोबिक इंटरेक्शंस. ओके, सो दिस इज फॉर्मिंग द क्वाटरनरी स्ट्रक्चर. So the common thing is that in primary structure, relationships between element is different. In secondary structure, relationships is different. It is due to hydrogen bonding. In tertiary structure, relationship is involves another type of interaction, that is due to disulfide bonds. In quaternary, relationships may be due to van der Waals forces, hydrophobic bonds. So this is the structure. So structure is basically relationships. Okay. So I think you understand this thing, but people are very eager to understand clinical things. I know. uh, I hope you will understand gradually, but we will go with first we clear the basics and we understand these terms more better, then we will apply these concepts. But still I have take one example, some medical example. Okay. mm, let's say I have taken my system as femoral triangle. Femoral triangle. Okay, here this is the inguinal ligament, this is the sartorius muscle, and this is the adductor longus. Okay, so what I am thinking, this is my system, this is the name of the system. What are its elements? Its elements are inguinal ligament, adductor longus, sartorius muscle, and what are the other elements? I will make some. This is artery, this is nerve, and let's say this is the vein. So this is vein, this is artery, and this is nerve. So what we are getting? A structure is the relationships between vein. These all are the elements. So what are our elements? Inguinal ligament, adductor longus, sartorius muscle, and these femoral vein, femoral artery, and femoral nerve. All these are our elements are there. Now after elements we have to think like this. What is its structure? So in this case we are actually talking about the spatial structure, that is morphology. So in that case, the vein is towards the medial end, artery is in between, and nerve is totally lateral. So this is the spatial structure, or we can call it morphology. We can call it morphology. I always stress, whenever I say structure, morphology is one type of structure. There are another type of relationships, means another type of structures are there. Definitely there is another different suppose this artery is definitely supplying this nerve or some blood supply to this nerve. So there is another structure we can create. Okay, same happens in our thyroid surgery also. Surgeon not always think of the spatial things, but sometimes we have to think of the functional structure. We have to test time to time this nerve is okay or not. Okay, there is neuromonitoring goes on. So these concepts are applying, but we are not thinking in that way basically. So I think widen your concept of structure, है ना, before beyond morphological structure. So this is one example. Okay, now we take some problems. I think Satnam has asked difference between the structure and process. Okay, so don't try to make these words mutually exclusive. Okay, they are all part of any system. ठीक है. हाँ, some medical term may tells you about the process. Let's say example, neuromuscular transmission. This is a medical term, neuromuscular transmission. As the name suggests, it is some sort of process. Some sort of transmission is a process. Okay. Now what you have to think? If this is a process, what is the system? So neuromuscular transmission occurs between a neuron and a muscle fiber. So we will take our system as a two cell. Okay. These are the elements of the cell. Now first thing is this. So if that word is a process, then you have to think of the system. Now you have to think of the structure. Structure, one thing is the morphological structure. Okay. How their invaginations or whatever the morphology is described, you can take one thing. That another structure is the communication part, how they are communicating. So that is basically a structure. Okay. So you have to think like this. This is one example. I will take one more example, so it will become a bit clear what is structure and what is process. Now what I am taking, I am just taking a smooth muscle cells, okay, of a pupil. Let's say we have a pupil. This is a pupil. Now we have smooth muscle cells arranged like this. These are the smooth muscle cells. Smooth muscle cells know one thing. When signal comes, they have to contract. They only know one thing, cell at cell level. Now our again think like this. We are talking about a pupil. Okay, pupil is sort of organ because इसमें यहाँ पे tissues भी हैं, एक muscular यहाँ पे smooth muscles. There are a lot of cells. Okay, so ये वाले एक cells हो गए हमारे पास में. So and they are supplied by all the these are supplied by, sorry, parasympathetic parasympathetic nerves. Okay, so what will happen? These are the smooth muscles cells. What is their structure? Structure means relationship between them. You can see here the relationship is spatial relationship, morphology. is end-to-end connections. They are connected end-to-end. Okay. So in this case, what will happen if input comes? When input comes, the size of the pupil will reduce. Okay. So if we think of a process, we can show like this. Let's say this is the size of the pupil. Size of the pupil is just my state. Okay. And let's say it's time. So what happens when there is input to these cells? The size of the pupil will constrict. It will goes to a new, it will enters to a newer state. Okay. The same pupil. Another case is what is happening. This is the same pupil. Now we have another set of smooth muscles. We have another set of smooth muscles, radial muscles. Okay. Again, here they are innervated by the sympathetic nervous system. Sympathetic nervous system. So the same smooth muscle cells, when supplied by the or excited by the sympathetic nervous system, they again contract. Smooth muscle contract. Same thing they are doing at a cellular level. The same thing is happening, but what will happen this time? It dilates. Okay. So we can say what process is happening there? It is mydriasis and it is meiosis. So you can appreciate what is the difference between these two tissues. We can say these are group of cells. This is group of cell. This is group of cell. The only difference is their spatial relationship. They are connected end to end. They are connected side by side. Okay. So because of the difference of the structure, okay, we can say the different processes happening or state is changing differently. In this case, mydriasis, pupil size is increasing, mydriasis is happening. In this case, meiosis is happening. Okay, so this is the structure. Structure means the relationships. It may be morphological or it may be another type of relationships. Okay, I hope difference structure you have cleared the concept of structure. Another question some people have asked are now they will go again to what they are learning, and now they have what they have to do. They have to first think as far as living systems are concerned, at what level they are learning. First of all, at what level of organization they are learning. So on that level of organization, you first find the system, elements of the system. Is it cells, or is it molecules, or is it tissues? And you will try this like this. So at least you have something to think कि how you will organize the things. ठीक है. I am not going to give all these things, all the facts कि कैसे उसको करना. I am just giving you the idea how you have to approach a subject. ठीक है. uh, I asked a question about the anesthesia and surgeon. While operating a patient, the system for the anesthetist and surgery, for both individual, the system is same or not. Okay, so mostly people tell rightly no, because for a surgeon, system is something different. Its elements are different based on his or her specialty, what or what type of operation or surgery he is doing. Okay, and for anesthetist, system is definitely different. Somebody write not clear, so you can think like there is an aircraft. Okay, and aircraft is viewed or observed by a aeronautical engineer. Same aircraft is viewed, observed by an electrical engineer, an IT engineer, and different persons. Okay, everybody has a different perspective. Everybody has a different perspective. Somebody is thinking of an electrical engineer, is thinking of its electrical circuits, whose components are different, whose elements are different. Okay, for an electrical engineer, all the electrical circuit is his system, and rest are not. I am not saying not important, but they are environment. They are environment. The same thing happens in, I think, medicine also. Once specialties develop, okay, specialties develop. So what a specialist sees is his environment, and rest is the environment basically. Okay, what he focus is the system, and rest is the environment. Okay, environment is equally important. You have to learn about the interaction with the environment. Okay, and one question again, one word that I think I got few responses for that is I asked what is science. So what is science is very important question. Okay, once you are interested a little bit interest in research, then you should know what is science. है ना? And this science is again a approach basically, and this needs a totally devoted lecture for to explain the science with some examples. What is science? But you can think science is you have learned about the scientific method. Okay, so scientific method, the steps of scientific methods are we have to follow those methods. Okay, so science give us some answers to our questions. Okay, but those answers are based on science, means those answers have to go through a method known as the scientific method. Then only we can prove that it is the answer is based on the science. Okay, but this needs a totally different lecture. So I think for today we will pause here, and lot of concepts we have discussed, but there is more things we will discuss about the process and about the states also, that we will do tomorrow. We will tomorrow we will talk about the states, parameters, constants, and different type of process. Once you go through the different types of process, then you will feel something good. Ki what are the different processes? I have to how I have to think. Ki once I found a process, then what the other things I have to think. Okay, so I am giving you something to, on which you can think at least. So thank you very much.